Hi guys, my name is Jasmine Locklear and this is my video presentation for Bio 1030. And at the beginning of the semester we were told to choose a topic that we would like to make a video on, and I chose chronic kidney disease or acute kidney disease and diagnosing kidney disease. And behind me I have a board with an overview of important things I thought that I should mention, and you can read it as well as I go along. And then at the end of the video I'm going to show a picture of kidneys and show you the locations of certain things in the kidneys or around the kidneys. And I just wanted to go ahead and get started. And so like I said, my topic is diagnosing kidney disease. So what is kidney disease? And if you look up here, chronic kidney disease is the gradual loss of kidney function. And your kidneys are supposed to filter and excrete urine, and in some cases they don't do that, and that is known as kidney disease when they don't function properly and do their job. So why I chose this topic. So my father was diagnosed with kidney disease in 2015. And a little backstory on that is he wanted to go to the military, into the military when he was 19. And that didn't quite work out because he had a very high amount of protein in his urine, and so that didn't allow him to come into the military, which no one really said anything. And at that age you don't really realize, oh well, you kind of just blow it off and say, okay, well, never mind. But that was kind of a sign back then. He was diagnosed in 2015 and he was 32 to 34 years old, and he unfortunately passed away in 2017, and it was due to other underlying conditions, but his kidney failure did contribute to his passing away. And I chose to do this topic for him, and I feel like it's important because this isn't something that's really talked about a lot. And even though 15% of people are diagnosed with kidney disease, I still feel like, that's a very large number for it to not, be recognized and talk about as much. So that's why I chose to do this topic. And next I'm going to talk about how it's diagnosed. So urine output measurement, so it measures how much you urinate in 24 hours. If it's a lot, if it's a little, that's typically what that is. A urine test, it analyzes for abnormalities. It's also called a urinalysis. You have a blood test. A blood sample may reveal rising levels of urea and creatine, and there's also another name for it. I can't remember what it's called, but there is also another name for it. Imaging test. It's like an ultrasound that they use to see your kidneys, see them moving, see, what's going on. And then they also remove a sample of kidney tissue, and they look at that as well. So we're going to next talk about signs and symptoms or early detection. So early kidney disease usually doesn't have any symptoms. I looked and there's really no symptoms that you can kind of look for. It's more of like when you go to the doctor or things that they notice. There's nothing that you can look around for or check on yourself. But there are predetermining factors, I guess you would say. That's what that is. So if you have diabetes, I would say anyone in your family who might have diabetes, I would get checked. High blood pressure, anyone in your family that has high blood pressure, or if you have high blood pressure, I would get checked. Heart disease, if you have heart disease or anyone in your family has heart disease, I would get checked. And then a family history of kidney disease. It's very important that if you have had a family member who has had kidney disease, that you get checked as well. I personally haven't gotten checked. I know that my mom, she wanted me and my siblings to get checked as well, because that's one thing that we did not know about, is that if someone in your family has kidney disease, you could possibly get kidney disease as well. So basically it is hereditary. And albumin. I made a separate portion for albumin because it is very important. Albumin is a protein that they check for, and albumin is a protein that can pass into the urine when the kidneys are damaged. So that is something that they also look for. So they look for albumin because it tells you that your kidneys are damaged. So basically, you do not know you have kidney disease until it is too late. I don't want to say it is too late, but kidney disease is slow and it progresses. And typically, as I said, there are no signs, there are no symptoms that you can look for yourself. So usually your doctor can catch it early on, or it could possibly be too late and your kidneys are, further damaged or anything like that. So it is, I would call it a silent disease. Personally, I would. And when you are diagnosed with kidney disease, there are a lot of lifestyle changes that you go through. I know personally my daddy struggled with his diet. That was not an easy thing for him because you do enjoy certain foods, and then there's certain foods that you cannot eat anymore. And it's a lot of foods with sodium and potassium and a lot of foods like that. A lot of foods that we typically enjoy. And I know that when he was diagnosed with kidney disease, I didn't really talk about treatment here because I wanted to focus more on like the diagnosis and before, and then your lifestyle changes. So I really didn't do anything on treatment. But my dad, he did go through dialysis. Is where they filter, it's a machine that filters your fluid. He didn't do hemodialysis, he did the other dialysis. And so some of the lifestyle changes that he went through and some that some other people go through are they have to choose lower potassium foods or completely cut out potassium foods. They have to avoid products with added salt, and they have to avoid adding salt to them as well. And then they also have to limit their phosphorus. And now I'm going to show you an image of kidneys, and I'm going to label it as I go through. So this is just a quick overview of your kidneys. As you can see, they're shaped like kidney beans. We've always heard that they're shaped like kidney beans. So this is your right kidney and this is your left kidney. And these tubes that are coming out, these beige colored tubes, they're your ureters. And I hope I'm saying that right. And this is where the urine passes through to go to your bladder, and your bladder would be located down here somewhere. This is your inferior vena cava, and this is your descending aorta. And these red and blue little smaller tubes are your renal arteries and veins. And that is pretty much a quick overview of your kidneys. Appreciate you sticking to the end if you did stick to the end watching this video. And basically, I just want to end it off saying, go get tested. It's important that you get tested. I mean, as I said earlier, 50% of people have chronic kidney disease, and that's a very large number. If you have anyone in your family who has diabetes, or you do, or heart disease, or high blood pressure, or anything like that, I highly suggest to go get tested. It's important that you do because kidney disease is a silent disease. Like I said, I personally feel like that. You don't know your signs and symptoms. So it's highly encouraged that you do go get tested. And not only for yourself, but for your family. Kidney disease not only affects you, but it affects your family, affects your children, your wife. And it's a hard process to go through, but you do have a support system. And I'm going to end the video off with that, and I hope you all have an amazing day.